In this video, I'm going to show you 3 simple exercises that people with lumbar radiculopathy can use to move better and feel better. Before we get to the exercises, it's important to understand what lumbar radiculopathy actually is. Now, this problem occurs when one or more of these spinal nerve roots becomes irritated or compressed, which often causes pain that starts in the lower back and then radiates down into the buttocks and legs. The type of pain that people with lumbar radiculopathy get is unique, and it's often described with terms like sharp, stabbing, a jolt, a bolt of electricity, or an intense burning sensation running down into the legs. And because the affected spinal nerves carry both sensory and motor signals, you can also see symptoms like numbness and tingling, and even muscle weakness in the lower extremity. When someone has lumbar radiculopathy, we know that those spinal nerve roots are being impacted. What we don't know is what's affecting them. But the most common causes of lumbar radiculopathy are things like disc bulges and herniations, arthritic changes, degenerative disc disease, and spinal stenosis. And the exercises that we're about to go over are aimed primarily at situations like those. But lumbar radiculopathy can also be caused by other things like osteoporosis and compression fractures and even spinal tumors. And so I want to stress that it's really important that before you begin any treatment that you have your problem professionally assessed so that you understand exactly what's affecting your spinal nerves. So with that said, let's get into exercise number 1, which is a gentle stretch that'll help you to improve your flexibility across your hips and lower back. To set up for this stretch, just go flat down on your back on a comfortable surface. Starting out, your knees are going to be bent to about 90 degrees and your head should be resting comfortably on the floor. From there, you're going to extend one leg straight out in front of you, and the opposite leg you're going to bring up, grasp behind the knee with both hands, and slowly begin drawing that knee towards the shoulder on the same side. And the closer you pull that knee to your shoulder, the more stretch you're going to get across the back of your thigh, through your pelvis, and into your lower back. Want to hold the stretch, progressively pulling the knee closer and closer for 30 to 60 seconds continuously. Extend that leg, draw the other leg up, and repeat on the opposite side. Here are a few little tips to help you get the most out of the knee to chest stretch. First, some people find that this stretch is uncomfortable because as they're drawing that knee up to their shoulder, the thigh puts pressure on their ribs or their abdomen. Now, if that's the case for you, it's a really easy fix. All you need to do is bring that leg a little bit away from the midline of your body in this direction, like 10 or 15 degrees, and that thigh will clear your rib cage, and then you'll be able to draw straight up to your shoulder, and you might even be able to get deeper into the stretch with the leg in that position. So, something to keep in mind. Second, some people find that this stretch is just too intense for them, and if that's the case, then all you need to do is not pull the leg up so far, or you can take that down leg and get it to a bent knee position, and this really reduces the amount of strain from this movement. Now, slowly over time, you would want to work yourself up to the point where you're using less and less of a bend in the knee, working slowly towards that straight leg position and hopefully becoming more comfortable as you go. And then for those who are at the opposite end of the spectrum who want to feel this stretch even more into their lower back and pelvis, what you can do is get a little bolster and place it underneath the upper portion of the back of your head like this, so that your forehead is above your chin and your neck is slightly flexed. And then when you perform this stretch from that position, you're going to feel it much more around the base of your sacrum and into your lower back. Exercise number 2 is the McGill curl up, and this is the perfect transition from flexibility training into strength training because this movement is also done from the floor, and it's going to give you a safe way to strengthen some of the most important spinal stabilizers in your entire body. To perform the McGill curl up, the only thing you're going to need is a comfortable surface to lie on. Once you've got that, just go flat down on your back. Leg position is easy. You're going to extend one leg straight out in front of you. The opposite leg, you're going to keep a bent knee, and your foot will be positioned at the level of the knee of the straight leg. Head and shoulders are resting comfortably. You're going to take your hands, slide them underneath the small of your back. If you need a reference point here, you're going to find the wing bone just over your hip called the iliac crest, And you're going to slide the hands in right above that. Now, this is one of the critical differentiating factors of the McGill curl-up, is that by having your hands here, you're going to be able to maintain the normal curve in your spine throughout the movement. Hands are resting comfortably. Next factor that's important is head position. You need to make sure that the back of your head, not the top of your head, is in contact with the floor. So to do that, you're going to engage the muscles on the front of your neck and watch that chin drop down, just like that. You'll know you're in the right position when your forehead and your chin are in line with one another, and that line should be running parallel to the floor. Once you're in this position, to perform the movement, you're just going to elevate your elbows off the floor, just about 1 to 2 inches. This is going to make sure that you don't cheat by using accessory muscles, and then you're going to keep that alignment of the forehead and the chin as you pull your head and shoulders 1 to 2 inches off the ground. You want to make sure that your tongue is pressed up to the roof of your mouth while you're performing the curl up, and that you're breathing deeply through the nose. Hold for a count of 10, and then slowly return the head and shoulders to the ground and allow the elbows to rest. You'll rest for about 30 seconds and then repeat. Again, elbows off the ground, tongue to the roof of the mouth, forehead and chin are in line with one another, 1 to 2 inches off the floor. Breathing deeply. Feeling the muscles in the front part of your neck and your abdominal wall all the way down to your pubic bone working the whole time.
Exercise number 3 is a modified step up, and this one is a double whammy that can help you to simultaneously stretch out and strengthen muscles that can take a bunch of pressure off your spine. The only thing you're going to need for this exercise is a stable platform that you can safely step up onto that's about 10 to 20 inches tall. Once you've got that, stand facing your platform, and you want to position yourself about 2 to 3 feet away. From there, stand up nice and tall, lightly brace your core, and then step up onto the platform with one foot, slowly bending that knee as far as you can comfortably go. Notice that at the bottom of the position, I still have that nice upright spine, and in order to get as deep as I can comfortably go, the rear heel has to come up off the floor. Hold that position for 2 to 3 seconds, and then in one controlled motion, press out of it, and slowly back to your starting position. Switch over to the opposite leg, and do the exact same thing. Remaining upright the entire time, hold the bottom position for 2 to 3 seconds, one controlled motion, back to the start. Here are a few tips to help you get the most out of the modified step up. Number 1, it's kind of counterintuitive, but when you're first starting off with this exercise, using a higher platform is actually much easier and less demanding, both in terms of strength and flexibility. So you can be towards the upper end of that range and use something that's 20 or even 24 inches off the ground, and it's not going to require nearly as much strength to get into and out of that position. So keep that in your back pocket. Number 2, if your ankle flexibility is a problem, it is possible to do this exercise while up on the ball of both the front and the back foot, and that'll make it much more doable if ankle flexibility is your limiting factor. Number 3, when you're first starting off, I strongly recommend performing this exercise right next to a wall, because being able to reach out and have some external support to help maintain your balance and even to help you out of that low position so you can kind of push off and get some help from your arms, it's really confidence inspiring, and it enhances the safety of this movement. So use all of those tools as needed to make sure that you're safe and successful with this exercise. Doing just 10 to 20 of these modified step-ups each day helps to accomplish 2 really important things. First, it maintains the flexibility and strength of your feet and ankles. And when your feet and ankles are working properly and at full capacity, they can absorb a lot of impact forces, which takes a tremendous amount of strain off of your knees, hips, and your lower back. Second, it maintains your hip mobility. And one of the things that we commonly see in people with chronic back problems is that they've got really tight hips, and that they're particularly limited in hip extension, which is the exact motion that the modified step up is targeting. If you're looking for more ways to build really strong spinal stabilizers, click the video here. And if you want to see some simple lifestyle modifications that can dramatically reduce your back pain, click the video here. Beyond that, I just want to thank you so much for watching. Make sure to hit the thumbs up button and that little subscribe button before you head out of here, and I'll see you next time.